insightful discussion brought to us by Living Goods, of course. And the title for this one is Beyond Boundaries, Scaling Digitized Community Health Systems for the Future. As always, we have a fantastic team who will be led by a fantastic moderator. And our moderator for this session is none other than the Chief Digital Health Officer at Living Goods, Kanishka Katara, or better known as KK, as he has let me call him. And KK is the Chief Digital Health Officer at Living Goods, where he collaborates closely with the CEO to drive strategic initiatives in digital health, data, and technology that align with the organization's mission. He leads the vision, strategy development, and implementation of digital health solutions, co-designing approaches that strengthen national community health systems through robust performance management. KK joined Living Goods from Path, where he did the digital health portfolio for the South Asia hub. And he also previously directed government programs and partnerships for Dimagi, spearheading the world's largest digital health intervention in India. He holds a Bachelor of Technology degree from Uttar Pradesh Technical University in India. And he's also expecting us. He told me this before. He's expecting an extremely loud round of applause. He said that he's going to be disappointed if he doesn't have that. So let us not disappoint KK and give him and the entire panel a massive round of applause as we have our final session.
Thank you. Thank you. Karibu Sana. For my non-Kenyan friends, it means welcome very much. Let me say the next word I've learned in the Swahili language. Let me see if people can respond. Uko salama. It means, how are you doing? I know this is an afternoon session. It's always difficult to, for people like me to get their attention, but I hope I'm able to grab their attention because we have a fabulous panel here with us. And maybe I can just start by introducing the panel. We have Deborah. I'll let her speak. She is the star of the panel. Sorry, other panelists. She actually is a community health promoter. She is directly coming from the field to share her experiences and stories with her. Deborah, can I invite you to bring field to life for everyone here, specifically our friends coming from of the world?
Thank you so much, KK. Been said, I'm Deborah Marie Olumbo, a community health promoter from Kisumu County, Kisumu West Sub-County. I'm attached to Airport Health Center. I man 130 households. I enjoy my work so much. Thanks to Living Goods for giving me this platform to share my experience with all of you. And welcome to Kisumu, where real fish is. Thank you.
Thank you, Deborah. So all the fish lovers, you know where the place is to go to have fantastic fish. Let me move on to Emily to introduce herself. She is the new CEO for Living Goods. But Emily, why don't you bring us to life your story and what's your purpose in life?
Thank you, KK. So my name is Emily Chambert. I'm the new CEO for Living Goods. And I've been with Living Goods for the last 10 years. Back at the beginning of my journey with Living Goods, I actually worked in Uganda when at that time we were supporting community health workers, but they were still using paper. So I'm so proud to be here today. I've been with Living Goods, taking them on the journey to digitalize and professionalize community health workers. And I think this has been a journey. So being able today to share a bit more about this experience and how digital tools have really transformed community health system, community health worker, but also the communities that we're serving, I think this is really exciting. Thank you.
Thank you, Emily. Moving on to my next panelist, Jean Philbert. I hope I'm pronouncing it correctly.
Yes,
Please.
but you can call me Phil. Jean Philbert Nsengimana is my name. I'm the Chief Digital Advisor at the Africa Centers for Disease Control. I've been with the institution for 3 years, and previously I served in the government of Rwanda as Minister for Information Technology and Youth for about 6 years. Purpose in life, first time to be asked this question, but made me reminisce my childhood growing up in a very rural area in the western province of Rwanda, going to school barefooted with the dream of becoming a priest, a Catholic priest, because my parents were Catholic and the priest is the only guy who had a car. So I went to a seminary and then did math, science, biology, chemistry, physics, and developed love for medicine. So I started my studies at the university in the School of Medicine. And then 94 happens, genocide in Rwanda, the university closes. Come back to the university 3 years later, looked at computer science, which was very new at that time, and joined the computer science in the first ever cohort of computer scientists of Rwanda. And then later on, fast forward, I think I'm a blend of a priest, of a computer engineer, and a politician. Thank you.
Thank you, Phil. I hope a lot of us get converted in the name of digital now. Let me invite the last panelist, Sohail. He's coming all the way from India. So, Sohail, please share your journey with us.
Thank you. And first of all, I do want to agree with Kanishk on you being the real star, Deborah. We are all here to serve your needs, just to be very clear. And I cannot match John's introduction, so apologies. I'm part of Gates Foundation India office, the team that looks at digital and AI work in India and some bit of work that we support in the Southeast Asia region. Been with the Gates Foundation for close to 9 years now. It's actually a very interesting journey for me, coming from a corporate consulting background. And for people who don't know, Kanishka and I worked together in our previous lives as part of one of the consulting organizations. And, you know, just that, I was just sharing with somebody here, just that exposure to the real India, as I call it, which people like me sitting in cities, brought up in cities, just didn't know of or still are not aware, was a big realization on wanting to do something else in life. And here I am, trying whatever I can. Thank you.
Thank you, Sohail, and a big round of applause to the panel members once more. Now, I know that, you know, here are the stars and a superstar sitting on the panel, but let me have my 2 minutes of fame. That is my job, and then I'll bring the panelists in, asking some very difficult questions to them. So team, everyone, it's a privilege for me to invite you to the plenary, and I'm very grateful that so many of you have decided to spend time with us. I think in today's time, and we have seen this in so many low and medium income countries, the health systems continue to grapple with the complex challenges of delivering accessible healthcare services. And can I add the word quality to that? It is true in India, it is true in Myanmar, it is true in Vietnam, it is true in almost the entire continent of Africa. And that is how we have seen that community health workers, the workforce we have, which for a long time we did not even acknowledge as a system that they can play a role. Today they are at the forefront of this effort which all of us are making. They are the unsung heroes which bridge the gap in delivering the essential healthcare services to the underserved population. And we have Deborah on the panel, and I'm sure she is going to share more of what she goes through, what she handles on a daily basis. And yet, you know, while this workforce is with us, their daily work is getting hindered by a lack of adequate support, tools, and systems. And I'm sure there are so many voices in the room who will want to say that there is so much happening. And I think that's where the scale comes into the picture, that we are looking at scale. We are looking at, thousands and millions of this workforce across countries. Deborah alone, what was the number, Deborah, you said? 130,000 or something? That's the number she alone is supporting. Imagine the scale we are talking about. And there are so many Deborahs out there. Today, we must also acknowledge the mounting pressures of climate change. The economic instability and the limited resources, all of which will further test the resilience of health systems. But we are not only here to discuss the challenges, but let's also explore how bold transformative solutions look like. What is the impact digital is making on the field? Where are we going? Where do we go from where we are today? And one of the most critical shifts, and in my own journey, I have seen how digital has become so prevalent. Today, Emily shared with us, 10 years back, she actually led the sort of revolution by handing over the smartphones, the phones in the hands of the community health workers. This is not too different when, I don't know, Phil maybe remembers, Emily you remember, or Sohail or some other guests here remember. There was a time when Microsoft Excel, when it was introduced 30, 40 years back, it was celebrated. There were advertisements around it. And Microsoft was selling it as the next transformative tool. And that was the tool in those days. But do we even talk about Microsoft Excel? When someone joins a new office, do we even say that, oh, you will have the privilege of using a Microsoft Excel? And that's the shift which has happened. I think this is the shift we are talking about, that we are not talking about giving smartphones to the workers. We are actually talking the next level. How are these phones being used? Can we make them sustainable? Can we use data which Deborah is collecting out of delivering services in the field to do more, to do follow-up actions, to make a real impact on the field? I think that's what we are here to discuss. That's what we should keep our minds open and understand what can hamper it from today onwards. What are the challenges we are talking about in this changed reality of the world? I invite all of you to engage with an open mind, as I said, ready to push the boundaries of what is possible, while being realistic, while also looking at the sustainability side of things. And also talk about what are the actionable points we can take away collectively, individually, and as organizations. Let me stop here. This is a very passionate subject for me, but I want to give the limelight to my panelists. Thank you for joining us and for your commitment for being a part of this journey. I think you being here in that afternoon session shows a lot. So my deepest appreciation as an encouragement to the panel members for being here. I'm going to move on to a round of questions to my panel members, and I said difficult questions coming their way. And I'll also want the audience to participate, so keep your pens and papers out, or tabs or laptops, whatever you have. Let me start with the star of the show, Deborah. How are you feeling, Deborah, sitting in front of so many people? I know you handle much more difficult challenges in the field, but just look at the audience here.
I feel privileged to be here as a community health promoter.
So, Deborah, you did try to bring some context of where you're coming from. The best fish in the country is there. Let me ask you and open the discussion. As a community health promoter, can you share how digital tools, and you carry your smartphone with you. Are you carrying one now? Very good. So you carry your smartphones, the digital tools which have been given to you. How have they changed the way you deliver care in your community? What has changed for you? And are there any specific tasks or processes which have become easier, or have they become difficult for you? Maybe we can start there and just understand your own journey.
Thank you so much once again. The digitalization has changed my life so much, and even my work at the community level. One, like Emily had said, 10 years back we were using not just papers. we are using these big books, and we'd go with them to the community, and you want to register households and render your services to the household, and it was really bulky. And it was really stressful at the same time, because at some point you would go to a household where it is a poor household, where you cannot even find a table to put the book on. Now you have to put the book on your lap so that you can register the household or even render the service to the household. Thanks to digitalization, I only carry my MOH 100, my smartphone, and a pen. It's lighter, and my book, my red kit bag. So it's lighter and it is easier, and it has given me easy time in the community, and it has also given me good recognition in the community. If they see you working smart with a smartphone, they really respect you, you see? Because before we were using these small phones we call in Kiswahili kaduda, but now we were given smartphones. It made us shine in the community. We would feel on top of the sky because we are using smartphone. Again, it has standardized assessment. Back then, it was not easy to trace my under ones that I've assessed. But right now, my digital phone can give me how many under ones I've assessed, how many I've managed, maybe for diarrhea or even malaria or even pneumonia, how many are supposed to be followed up for maybe immunization. So it has given my work easy time, and as a CHP, I'm a mother. You tend to forget some things. But thanks to this digital phone, it reminds me on my taskbar. My phone has a taskbar that gives me performance. It reminds me on what I'm supposed to do on my day-to-day work, how to program myself, and how to go to the field. So it has changed my life a great deal. Not only me, but all the community health promoters. Again, it has also reduced my workload. I don't have to run around and photocopy papers to give to my supervisor for me to submit my reports. My reports are seen directly to the dashboard by my supervisor, and even my sub-county and even my county. So it has given me easy time in the community with my community members, even my household members. My little young boy doesn't have to tow my reports anymore because it is in the book, in the phone. Back in the days, I would find some pages missing, and I would wonder, how am I going to report the missing pages? So I'm very grateful for this opportunity I've been given to be one of the CHPs who are using this digital platform to do my work as a community health volunteer. Thank you.
Didn't I tell you she's the star of the panel? Deborah, let me ask a quick follow-up, small question. Were you scared ever when the first time the smartphone was given to you? Or you were like, yeah, this is a child's play?
Wow, I was very scared.
Okay.
Yes.
But you're comfortable now?
Yeah, now I'm comfortable. I was very scared at the first time because it was something I did not understand. But thanks to the living good teacher that we had, was very precise and very patient and very understanding. Taught us everything and how to do it step by step. Even if you forget something, he'll remind you in love. Thank you.
Thank you. I guess all of us are scared when we use something for the first time. And here is an example of how that she was able to get over her scare and use it to her own advantage. Phil, let me call you into the conversation. We just heard Deborah, speaking about how digital has elevated her position within her community, how it has really elevated. And I'm sure that has led to better partnerships being fostered between her and the community she serves. Now, in your role, and as an organization, Africa CDC has been at the forefront of formulating these partnerships to drive digital health systems. I would like, you to share a few examples where you have seen this work really, really well, or is there something you will want to share with the audience here of what examples stand out for you in terms of forging partnerships?
Yeah, absolutely. It's a great pleasure to be on the same panel as Deborah. Africa needs 2 million like her. 2 million community health workers to achieve our UHC objectives. And we need all those community health workers and community health promoters to be connected and equipped with the kind of tools and capabilities that Deborah has. And at the same time, when we talk about primary care, it's not just about community health workers. I think we also need to think about rural facilities, health centers, the places where Deborah has to refer some of the patients when she cannot provide the intervention that they need, at least at that first level. And we are talking about at least 100,000 health facilities that need to be equipped. So in my role at Africa CDC, the absolute top priority is primary care digitization. And this is not something that, of course, it's not something that is done at continental level, it is done at country level. And at country level, no one single actor can be able to digitize primary care. If I break it down in sort of top 5 components, you've got to provide power. Deborah's smartphone needs to be charged at some point. You've got to provide connectivity, internet. You've got to provide training, number 3. You've got to have additional infrastructure. All the data that she collects goes somewhere. That somewhere, it is either at the Ministry of Health, it is in a data center somewhere. So you need data storage and data and computing capacity to be able to process and make sense of all the data that is coming. So that's another component. And then you need platforms, like the reminders that pop up on our phone come from a software, come from an app. So you need an app, you need software tools and platforms that are able to collect all this data. So let me limit to that. Just with that, you realize that no one can do everything. Even governments, when they want to power all the health centers, they need to work with solar companies. If you want to connect, you need to work with mobile network operators. You have to work with satellite operators where the mobile infrastructure doesn't reach. You need the expertise of development partners. An example in point is the partnership that Africa CDC has developed with UNICEF. And I can see shown in this room, it's an initiative called Health Connect Africa to connect 100,000 facilities and 2 million community health workers. And you even need to first map them and know where they are, know which ones are connected, know which ones have access to power, and then you can be able to plan the intervention and you cost it, and then you can go out and mobilize resources to be able to solve the problem. So I would say the kind of partnerships that we are looking at are partnerships that bring governments together with the private sector partners, together with our innovators who are the ones that are going to develop all these apps, and then most importantly, partnering with communities and putting the people at the center, and always keep in mind that everything we are doing, as Suhail said, we are doing it for Deborah, but most importantly for the people. The impact that we expect, I can put it in 2 buckets. Digital is here for either saving lives or saving costs. There are many other things, including making money, but if we could just save costs and save lives. And I dare to say that paper kills. I think everyone here in this room has a personal story where you personally had to go in an emergency situation or take a loved one, and you realize that you need the doctor needs information, life-saving information that they don't have. Simple things like your blood type. your previous lab exam, and so on and so forth. So if we are able to digitize, there are studies that have shown that we can save up to 30%, 35% of the healthcare spending if we digitize. And on the scale of the continent, it's about $60 billion per year. So digitizing primary care, keeping in mind 80% of all care is dispensed at the primary care level, you can understand the economic impact of it. So saving lives, saving money, but also strengthening livelihoods. I think that's why we are here. And thanks for the opportunity of joining this great conversation.
Thank you, Phil. You obviously, gave a lot of food for thought on this. Linking different layers of digital. Digital is not just an application. There is so much more to it. So many layers have to come together for digital to actually work effectively. Sohail, if I can bring you into the picture on this point. I know, in your role as within the Gates Foundation, you obviously have been looking at how digital can work, how, in the context specifically of the context of UHC, the role which digital tools play. And if I can further narrow it down to the community health work. What is your perspective? What challenges, in your view, need to be addressed? Specifically from a UHC standpoint and also from a sustainability framework. If you can talk about, because we still need to make it sustainable. It's a good start, but how do we travel the long mile now?
First of all, I just want to go back to what Deborah, you started off with. I think a lot of the, especially community healthcare workers or frontline workers, as we call it in India, the work that we tend to start on digital health is usually digitization to begin with. So just simply convert your big bulky registers into an app. And to be honest, I used to be very critical about why are we just looking at digitization, right? There needs to be some transformation element built in. But now I've come to an understanding where I believe it's perfectly fine if it's just an efficiency play to begin with. So we go through that phase where we build efficiency, and I'll add the time-saving component as well, as you called out in terms of just once you get familiar with the tools, how much time does it take to input that data, the reminders, and then move to a phase where it becomes a job aid tool, just for the users of the tool itself. I think now is the next level of this. And when we talk about universal health coverage, and to fill your point on how important it is for this information to flow from the community to the facilities, is something which we need to start working on. I think a lot of effort has gone in towards the community side of the work, but the data information flow, especially in terms of continuum of care, or the referral pathways, and we know, right, to your point on how do we start using them to save lives, while Deborah can know that, okay, this is a high-risk pregnancy, now what do I do, right? How do I ensure that this woman is going to be referred to this particular facility, and that facility will have all the ANC data available from the previous checkups. And by the way, equally important is the backward referral, and we can get into many such examples as well. But that's the real opportunity. I think on sustainability, to be honest, I don't believe we need to look at only outcome-driven evidences for sustainability. As I said, the cost, the time, just the sheer efficiency play is a good enough answer. The unfortunate reality is that, and we as an ecosystem and a community need to do better, we don't have enough evidence on why stakeholders, especially government, policymakers, decision makers, need to invest on digital. We don't have enough evidence on that, and I just feel that we all need to make an effort to invest in that area. And I'm calling out, even as Gates Foundation, to invest in that area as well. Because for a policymaker, decision maker, and I say this very often, if you're going to be in a resource-constrained environment, you'll always have to make trade-offs, right? So why does it make sense for you to invest in digital and not create more facilities? You have to answer that question with data and evidence, right? So that's my take on it, and hopefully we will invest more going forward.
Thank you, Sohail. As always, from our consulting days, leaving some very hard questions on the table while answering most of them. Emily, let me, on this point, let me bring you into the loop. Living Goods, and you have been leading that journey for Living Goods. Living Goods has been able to position itself in such a unique way, establishing and transforming the way, people like Deborah conduct their work in the field. This digital transformation journey has taken a long time. But we also realize, and we heard from Phil, that partnerships are important. Can you, given the journey Living Goods has had, and specifically in your role as CEO, how do you plan to deepen the partnerships? And when I talk of partnerships, we are talking of government-led systems at scale, and which is where governments, tech partners, and donors like Sohail become very important to this. So if you would like to share that perspective with the audience.
Sure, thank you, KK. And Deborah, thanks again for being here, because I think we're having this discussion because you've been inspiring us. So I think partnerships play, a key role, as you mentioned. And I think if we want to move to the next phase, we need to really think about partnership even further in relation to really digital tools in the global health space. I think one thing that we need to think about as we think about digital tools, I think the first thing from a partnership perspective is how do we partner with the communities? How do we ensure that the tools that are developed are human-centered design, that they really fit to the local context? And, one tool for one country might not be fully suitable for another country. And I'll give you an example. When we partner with the government of Burkina Faso and DMAGI, we realized quickly when we started digitalizing community health workers that actually there was a big proportion of the community health workers that were illiterate. So, well, equipping them with an application, we were like, well, how do we do that? And so we had to develop two different applications, one for literate community health workers and one for illiterate community health workers. So that's just an example of how do you need to consider really the local context, and it's really important to listen to the communities, listen to the community health workers in the case of a tool for community health workers. So really having the user in mind, I think, is the first thing. Obviously, you talked about partnership with the government. I think building a strong partnership with the government and the ecosystem of partner is critical. And really thinking about how do you bring everyone to the same table, to the same plan, to the same roadmap is really critical. Because I think otherwise you end up having, many different tools that are not suitable for the plan of the government. So really thinking about how do you enhance the collaboration? How do you ensure that you bring all the partners? I think one example is here in Kenya, there's a platform for community health called CHW for UHC that is bringing the government and the different partners behind the same roadmap for community health. And there's one big pillar around digital health. And I think this has been helpful to really think together on what are the needs for the government, what are the needs for the country, and how do we, bring everybody together and ensure that then there's an alignment even with the donors, so that then instead of having small investment, very scattered, and sometimes some duplication, let's be honest, and I think we're all sometimes, many of us could be culprit, but how do we ensure that there's greater alignment so that then we create greater efficiency, and at the end of the day think we can have tools that can be more sustainable. I think one of the other key element also has been really thinking about, and I think you've touched base on that, is really thinking from a sustainability aspect. How do we ensure that there's shared investments, there's co-financing approaches, so that then, you know, all the different partners can really share those investment and can think about who's going to be the payer at scale. So that we're not just focusing on the tool itself, but really thinking about how are we going to make sure that there's cost efficiency behind it, but that both government partners, tech investors really share those investments, and in the long term really ensuring that you know, government can really fully own it. And one thing that we've been trying and been quite successful here in Kenya has been engaging with the county government on co-financing agreements. So across, you know, a 5-year period, 2 digitalized community health workers, 2 professionalized digital health workers in Kisumu, for instance, we've partnered with the government and have a clear co-financing agreement where role, responsibility, and investment are clearly laid out. And this, I think, has really helped from an ownership perspective to really drive more sustainability in the long term. And I think, as an example, Kisumu has actually been the pilot county here in Kenya for the electronic community health information system. So this has really helped from an ownership perspective for the county first, but then for the national country. So I think these are really critical elements if we think about sustainability. I think the last element I want to bring in is really also thinking about how do we measure success? What are the critical key performance indicators to really measure the success of the tool, the utilization, and the scalability? Because I think if you don't have, you know, strong monitoring framework that will make sure that, you know, the data that you produce is properly used, that decisions are better made, that, you know, usage from the different users are in place, I think it's going to be really complicated to really think about something that can constantly evolve, improve, and without this monitoring, it's going to be really complicated. So these would be really the different elements that I think can help to make those investment in digital tools more sustainable and scalable.
Thank you, Emily. And as you were speaking, I was linking to what Phil and Sohail said, and I possibly have a longer list of questions, but I just want to open it to the forum as well. You know, if, you know, audience, if, here is your chance. I had my 2 minutes of fame. Here is your chance to claim your 2 minutes of fame if you have any questions for the panel members. I see a few hands up. Yeah.
Yeah, no, this is a very relevant topic in the context of primary healthcare and digital transformation. Community health work, as Jean mentioned, that we need 2 million health workers for the Africa, which is a huge number. And most of the community health workers spend more time in recording, reporting, documenting than actual health service. Because everything comes and fall under them. And this I'm saying from my own experience, at least 9 years back when in India, I was in India, we introduced community health worker digitalized reporting system. It's not only reporting when they are providing services, that time they would report directly from the field. And also the advocacy, counseling, everything would be inbuilt in that tablet. But to take that decision within ministry, because I was part of those internal discussion, so I know how there are differences. But that has really changed the life of the community health worker. But there are challenges also. Means, and sometimes in that initial transition phase, the challenges are so high that it becomes additional burden to them. Especially connectivity. Now whether offline mode, online mode is not working because of 2G, 3G, 4G, 5G, a lot of issue. So in addition to that, what are the backup system we are developing for that? We should be hassle-free for the health worker. And then government need to have a real priority to invest in the area, because it cannot be donor-funded activity. So there has to be very clear strategy that the donor would be exiting within 2 years of piloting it successfully in one state. They need to exit out. Otherwise, it would be a 10-year donor-driven program, and it will never be successful and sustainable. So these are some of the things need to be considered when you are doing community health system digitalization work. Thank you very much.
Thank you so much. I think very valuable comments and inputs. I see that you have good observations, but not necessarily a question, or you wanted a response from the panel?
I'm talking the nations from Africa.
Okay.
Jean is from the Africa CDC, and I work with the Middle East and North Africa region in the UNICEF regional office. I'm health specialist for immunization and primary health care. So with my background, I am more interested to know if the Africa CDC is supporting in many ways.
Absolutely. Let me take one more question, and then I'll come back to the panel. I see more hands up, but maybe let me just.
Thanks a lot. It's going to be a quick question, I promise. And it's to Deborah. I'm Agatha from Simprints. We work a lot with community healthcare workers, especially in Ghana and in Ethiopia. And one of the challenges that we saw is a lot of the time there is a quite high turnover of healthcare workers, and training them on new digital tools is really quite challenging, I would say. And just a question to you. I mean, you mentioned that like the digital tool really improved the way you're working with your supervisor, which is great. And I just wanted to ask, is there any specific advice or anything that you guys developed or implemented that would help you have some alarm system, to go off when there is a new healthcare worker that maybe is not trained and maybe is, lagging behind a little bit? Because I think this is really one of the key challenges to solve for like full adoption and everyone being on board. Thanks.
Thanks. Let me allow the panel to respond to these two questions, and then we'll see how much time is left and we can come back. Phil, maybe.
Thanks you, brother, for the comment. I think I got more from your inputs and contribution than a question. But to the point of the challenges that the community health workers meet when their phones are not connected and offline mode and online mode, I think goes to the point that Emily made around doing a user-centered design. And user-centered design takes into account the level of digital literacy, for example, but also the level of infrastructure maturity that you have. Things that are bound to happen should be expected. Phones will run out of power. Internet connection will be lost. The phone will fall into the water when she's the mother, she's taking care of the baby, and it rings, and the time to remove it from the pocket, it falls into the basin she was washing the kids. So all of those things should be anticipated as the platforms, especially the tech part, the hardware part and the software part is being designed. Let me not dive into that, but thanks so much for sharing the experience of India, which is really similar to what we see in many parts of the continent.
Digital absolutely remains the same.
So I just want to make a small comment or request. So the backup in that case should not be you will also fill a register. I mean, seriously, that's still a problem we continue to face, where we have the app being used and then there's a ask coming in from some stakeholder saying, hey, but you should fill the register as well. And sometimes it's also the fear of the users, right? And I'm sure you went through that phase at some point. Genuinely, that's like the worst thing possible. We might as well not introduce anything digital if you're not ready to get rid of the paper records.
Very, very good point, the dual reporting point. And let me allow Deborah to respond to the second question, because this is so related to your work.
Okay. Thank you so much, Agatha, for your question. I don't know if I can call it a secret that we do, but in my community unit, we have the elderly who take time to understand the digitalization. Even after the training, we still have to go back and have our monthly meetings and ask for challenges. So if one of us has a challenge at some point, we take an initiative as CHVs to go with this particular person to the field. You know, some of us it is easy to demonstrate than to show. So we go to the field and demonstrate what is supposed to be done. And now with this, they understand it better and faster. So that is what we do as a team. We have teamwork. Every month we meet when we are submitting our reports, and then we just ask for challenges. If one of us is facing a challenge through the phone, we handle it together. We go to the field together. In fact, in my community unit, we are paired. If your village is near a certain, your fellow CHP, you're being paired into 3 or 2. So if one of you has a challenge and the other one understands, we just go through it together until we understand. Thank you. I hope I answered your question.
Well, you have more than the reception talks about it. I know there are many hands up. I know there are many legitimate questions and observations on this, but my kind panel hosts have been giving me the cue that your time is up. I just wanted to bring in Mr. John Wanyungu just to say a couple of words because he is from MOH Kenya. He has been an integral part of leading this journey. So can I request you to just say a few words?
Let me do to you. Good evening, everyone. Yeah, my name is, maybe could come over? Yes, my name is John Wanyungu, working with the Ministry of Health. I coordinate implementation of ECHs in the country, that's Kenya. And first I want to tell Deborah, I'm very proud of you. Thank you very much for a great presentation. These are the kind of community health workers we have in Kenya. As you can see, she represents 100,000 other community workers in Kenya. Thank you very much, Living Goods. So for information, before Kenya as a country thought of digitizing community services, Living Goods already thought of that. We actually picked the idea of digitizing community health services from Living Goods, but now with the government leadership, working together with other partners, we've been able to scale digitization of community services across all the 47 counties in Kenya. Thank you very much, Africa CDC, again for taking on community health as one of the core components of African CDC. I was in Addis 2 weeks ago discussing African continental community health, how we can better community health on the continent. And so one thing that I would urge African CDC is to harmonize community health service delivery across the continent. So the community health service delivery in Kenya should be the same as in West Africa, in Southern Africa, in Central Africa, with clear service package which are costed and analyzed for cost effectiveness. So that when we employ technology, we employ technology on a standardized community health service package across the continent. So in Kenya, we have a platform that brings together all partners in community health, and that has made it very easy for us to drive digitization of community health services in Kenya. So we have a platform we call CHW for UHC, Community Health Unit for UHC, which brings together all partners under the stewardship of the ministry. And with that, we are able to discuss, share experiences. And when we have a big task ahead of us, we split among the partners. And that's how we're able to drive or to scale each is very fast, because we split the country among partners, and partner X will take 4 counties, 5 counties, 10 counties. And within a span of 2 to 3 months, we had ECHs all over the country. So thank you very much, our partners. Thank you very much, Africa CDC, for leadership at the continental level. And as a country, we are leading in digitizing community services. And you are free to come and learn from us more and more. We are available and willing to share our experiences with you. Thank you very much.
Thank you. Thank you to MOH Kenya for leading this effort. And as we say, all eyes are on Kenya right now to show the path. It's an exciting start, but there's a long journey ahead. And we heard some of the panelists talking about some of the challenges and how we can work around them. I know there are so many questions, still there are so many hands, but I have to stop. I have my dear friend on the panel. But let me assure you, the panel members are not running away. Please feel free to engage with them after the session. And Deborah is here for the duration of the workshop. She'll be just somewhere around our Living Goods booth. So please feel free to come and engage with her. And thank you so much for staying with us. Thank you.
Another round of applause for the team. Thank you so much, KK. And please blame me for him rushing and cutting everything short. Thank you so much, Living Goods, for that presentation and panel discussion, plenary. We really did appreciate the learnings that we got from there. Ladies, gentlemen, we are done with day one. You know, normally at other conferences, I have to struggle to get people energized, but I think this time round, with all the discussions we've had, the energy levels in here are off the roof. So just a few things to note. Number one, and please answer all back at the same time. I'm one of those teachers who was not very good in school in terms of how I manage the class. So just shout out and answer yes or no. Did you learn something new today? A bit louder, everybody. Okay. Did you meet someone new today? Did you enjoy your meals? Are you excited for tomorrow? Is Kenya the best country in the world? Do you plan to never leave? Will you stay here forever and ever and ever? Will we see you tomorrow morning? Thank you so much. We have an exciting day tomorrow. An announcement that is new that you may not have heard is that we are excited to welcome the Cabinet Secretary from the Ministry of Health tomorrow. Dr. Deborah Baraza will be here at 2 p.m. So she's going to come during lunch. So we're encouraging you. She's going to give her remarks at 2 p.m. So have a very brief lunch. Again, we'll remind you tomorrow. But she will be here. So if you'd love to interact with her, please do join us for that at the main stage. Also, in an hour, well, less than an hour now, about 50 minutes, we're going to have our happy hour, which will double up as a happy hour. So it'll be an opportunity we'll feature more than 40 solution demonstrations in this very room. At exactly 6 o'clock is when we want to start. And both alcoholic and non-alcoholic beverages will be served. Just for us to celebrate the end of day one again. We've had a fantastic kickoff. I'm so excited. We're only on day one, and there's so much more to come. I can see some of our happy hour teams are itching to set up. We're going to do it in another moment. And for those of us who are online, our virtual programming also starts with this happy hour. So follow the agenda to see what sessions you can tune into right now. Ladies and gentlemen, please turn to your neighbor and give them a high five. Please shake their hand. And tell them you have done well, and I will see you tomorrow, 8 a.m. Please be here sharp so we can get started. I'm going to ask us all to kindly leave the room with a round of applause. If everybody can leave the room so we can set up, but give yourselves a round of applause as you go. Please leave the room so we can set up for the happy hour. But thank you so much for all of your time, your attention for the day.